Cefotetan is a type of antibiotic that is used to treat a wide range of bacterial infections. It may also be used before and during certain surgeries to help prevent infection. This medication is known as a cephalosporin antibiotic, and it works by stopping the growth of bacteria. It's important to note that this antibiotic only treats bacterial infections and will not work for viral infections such as the common cold or flu. It's also important to use this medication only when it's prescribed by a doctor, as using any antibiotic when it's not needed can cause it to not work for future infections. The dosage and timing of taking this medication will depend on the specific infection and should be determined by a healthcare professional. Make sure to carefully read and understand all the instructions provided by the manufacturer for preparing and using the medication. If you are using the frozen pre-mixed solution, thaw it at room temperature or in the refrigerator. After thawing, shake well and check for leaks before using. This medication is given by injection into a muscle or vein as directed by your doctor. To get the best results, use this antibiotic at evenly spaced times and try to use it at the same time every day. The dosage will depend on your medical condition and how you respond to the treatment. It's important to continue using this medication for the full prescribed treatment period, even if your symptoms improve. If you stop the medication too early, the infection may come back. Make sure to learn how to store and discard needles and medical supplies safely. If you have any questions, consult your pharmacist. Some common side effects of using Cefotetan Vial may include swelling, redness, pain, or soreness at the injection site, loss of appetite, nausea, vomiting, diarrhea, or headache. However, many people using this medication do not have serious side effects. It's important to tell your doctor right away if you experience any serious side effects such as dark urine, easy bruising/bleeding, fast/pounding/irregular heartbeat, seizures, unusual weakness, yellowing eyes/skin, or mental/mood changes. In some rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms like persistent diarrhea, abdominal or stomach pain/cramping, or blood/mucus in your stool, it's important to contact your doctor immediately. Prolonged or repeated use of this medication may result in oral thrush or a new vaginal yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. It's rare, but a very serious allergic reaction to this drug may occur. Seek medical help right away if you notice symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, make sure to contact your doctor or pharmacist. It's important to talk to your doctor or pharmacist before using Cefotetan if you have any allergies to cephalosporins, penicillins, or other substances. This medication may contain inactive ingredients that could cause allergic reactions. Before using Cefotetan, make sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, stomach/intestinal diseases, or if you use or abuse alcohol. While taking Cefotetan, it's best to avoid alcoholic beverages and for at least 3 days after finishing the medicine to prevent stomach upset, cramps, nausea, vomiting, headache, and flushing. Cefotetan may also affect the effectiveness of live bacterial vaccines, so it's important to inform your healthcare professional before having any immunizations or vaccinations. If you are pregnant, it's important to discuss with your doctor before using this medication. Additionally, this medication can pass into breast milk, so consulting your doctor before breastfeeding is advisable. Remember to follow your doctor's instructions carefully for the best results. When taking Cefotetan Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Cefotetan Vial include aminoglycoside antibiotics, such as tobramycin, gentamicin, blood thinners, such as warfarin and chloramphenicol. Additionally, this medication may interfere with certain lab tests, such as urine glucose tests and serum or urine creatinine tests, potentially causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using this drug. As always, it's important to follow your doctor's guidance and to take the medication as prescribed. If someone takes too much Cefotetan Vial and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, residents can call 1-800-222-1222, and in Canada, residents can call their provincial poison control center. Symptoms of an overdose may include difficulty breathing and seizures. It's important to remember not to share this medication with others. This medication has been prescribed specifically for your current condition, so it's crucial not to use it later for a different infection unless your doctor instructs you to do so. Your doctor may also conduct lab or medical tests, such as a complete blood count or kidney function test, while you are using this product. It's important to keep all medical and lab appointments and consult your doctor for more details. If you happen to forget a dose, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and continue with your regular schedule. Do not take a double dose to make up for the missed one. Before using Cefotetan Vial, make sure to store it at room temperature and away from light and moisture. Do not refrigerate or freeze the dry powder. Different brands or packaging of this medication may have different storage requirements, so be sure to read the package labeling or ask your pharmacist for specific instructions. It's important to not store it in the bathroom. Once the solution is mixed, store the containers in the freezer at or below -4 degrees Fahrenheit -20 degrees Celsius. If you choose to store it at room temperature, make sure to use or discard the thawed solution within 24 hours. Always consult the package instructions or your pharmacist for any other storage details, and be sure to keep all medications away from children and pets. When it is expired or no longer needed, make sure to properly discard the product by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.